Welcome to the Hospital Infantil de las Californias, where wonderful things happen for children. We are conducting a telemedicine conference with UCSD and the medical students who are going to learn about cleft lip and palate surgeries. We'll be doing charitable operations, so these beautiful little babies will get the care that they need and the reconstruction so that they can live normal lives.
Telemedicine has an incredible future in many healthcare environments. I think when you're providing care over borders, it's an kind of an extreme situation where there is a very clear-cut logistic and geographic challenge. ConnectMed was developed to provide multidisciplinary, long-term follow-up care for patients that have deformities. And multidisciplinary care is really the gold standard for many reconstructive surgical problems like cleft lip and palate, where a surgery can make a huge difference, but essentially the outcome is dependent on having an entire team and providing follow-up throughout a child's life, including speech therapy, audiology, ear, nose, and throat, and social work, psychology. All of those things are what are established internationally as a gold standard, and what we're trying to do is provide those services to parts of the world where they don't have access to that specialty care. Telemedicine has actually been shown in multiple studies to be an incredible educational tool, as well as having incredible potential for the future of medical care delivery. But in terms of educating medical students, for surgery in particular, students have been shown to learn better sitting in a conference room watching surgery from a camera that's directly over the surgical field, because they can see the operation more clearly than if they're huddled around an operating room. They feel more comfortable asking questions to a surgeon because there's a little bit of comfort in being detached from the situation that may be somewhat perceived as stressful.
I've never observed a surgery like this. I've never been able to really watch from the surgeon's perspective or close to it, right over the surgeon.
My first experience with telemedicine is I was actually at my medical school campus at our telemedicine building. I watched Dr. Gossman do her procedures. She gave us a general overview. The fact that all these doors have been opened and not even have to leave our campus, that's such an amazing learning experience. Right now, we're really excited on our medical school campus to be included in these opportunities.
This technology is a game changer. I feel that we are really able to learn so much more and to experience a new perspective on surgery. I also think that it's really important to bring what resources we have here in the United States to other countries in places that they don't have those resources. So, say hospitals where they don't have a surgeon in a certain specialty, the ability for one surgeon that's specialized here to be able to log onto the computer and walk another surgeon through a surgery that they've never done before is really miraculous.
And just hearing about how we've got a system set up where we can follow them post-op, make sure that they're recovering well. Even if we're not there, we can do it via telemedicine is phenomenal. And I think that's how all care should be.
I think that telemedicine really has a potential to reach out to a really wide variety of people, especially in an environment like this in Baja, California, where there's a lot of people who are kind of spread out and in remote areas. Those services are very limited, and even in the US, but certainly in remote areas of Baja.
Just being able to see what a difference we can make by going there and doing a surgery, how many people come rushing forward because they need help, and just knowing that we can make the difference in their lives, that's huge for me, and I want to be a part of that.
We can take this technology and broaden it to rural areas. It might be for consultations, it might be for follow-up surgical care, it might be for referrals. There's all sorts of wonderful applications that we can use telemedicine for. So with collaborative partners and the champions out there that want to advance telemedicine, we can make some pretty wonderful things happen for thousands and thousands of kids and students and across borders. Let's make it happen.